So the warmer the climate is, or the warmer the atmosphere is, it means that you have mosquitoes being able to survive better within that space. Nigeria, as it is currently a malaria endemic country. And a lot of African countries or countries in the tropical regions have malaria endemic because the species can thrive. With climate change and with warmer climates, it then means that we're having more mosquitoes that are carrying more diseases like malaria, dengue, Zika virus, and transmitting it from one person to the other. Some months back, there was an outbreak of cholera in Lagos. We're not talking about even larger diseases like coronavirus, Ebola, and things like that. All of these things are things that evidence has shown that are as a result of climate change, and we're getting to see them happen more and more.
Hi guys, Nigerian Health has evolved over the years from a health intelligence platform that was founded in 2007 to becoming a trusted advocacy partner supporting development programs across Africa. You see, as we mark 10 years of driving policy conversations at the Future of Health conference and convening decision makers and health experts across the world, we'll be discussing one of the most critical global health issues of our time, and that's the intersection of climate change and health. And why now? Nigeria is expected to become the third most populous country by 2050. This means that climate change threatens to worsen our health inequalities as we know it, thereby affecting our overall health system, our environment, and the way we live. To break all this down, we're super excited to announce the launch of our Climate Conversation series, where we'll be discussing with leading experts at the forefront of addressing the climate and health crisis. So be part of the conversation by tuning into this podcast series or joining us on the 23rd and 24th of October 2024 at this special 10th edition of the Future of Health Conference, where we'll be discussing sustainable solutions to address the impact of climate change on health. See you there. Welcome to another episode of the Break It Down podcast. This special edition is the Climate Conversation series leading up to the annual Future of Health conference organized by Nigeria Health Watch. As you know, the Future of Health conference in the last 10 years has driven impact and sustainable development within Nigeria's health sector and has cut across African nationalities as well. Organized by Nigeria Health Watch, brings together every year industry leaders within the health space in Nigeria and beyond to move the health sector forward. And this year, we're focusing on a very interesting topic, which is the climate and health nexus, to really unpack how climate change impacts on health. There are various ways in which this happens. There's evidence to back this up, and to speak to this evidence and insights is a very special guest from an organization that is very data-driven and technology-savvy, eHealth Africa. Temitayo Tella-Lah, you're very much welcome.
Thank you very much.
Yes, I'll basically stick with Temi. I mean, that's what I've called you.
That's fine.
For quite a while, and it makes it easier. Thank you very much. You're welcome. So good to have you.
Thanks. Great to be here.
Yes, I've actually been looking forward based on the conversations we've had leading up to this. There's so much insights to share based on your work, based on the context in which we live in. I mean, we know that you and I know, and in fact, we want to make it more apparent and spotlight that more to the average Nigerian, how climate change impacts them, that it might not be immediately apparent to them, or we feel this, we might not immediately see, or we might not know what the numbers are, or the average Nigerian might not know what the numbers are in terms of increasing temperatures. But we know that earlier this year, for instance, we feel it. We felt heat waves in the country. We had that temperatures reached about 47 degrees, right, in northern states like Sokoto. And of course, we know how this affects lives and livelihoods. So based on your work, right, you've been very impressive. You have over 11 years experience in public health program management, basically climate risk assessments. You've worked within the climate health nexus, and you've seen significant insights on not just how this climate change affects us, but also what is being done. But would like to break this down for the average Nigerian, right? So imagine I am an 18-year-old Nigerian living in Surulere, Lagos, and I'm the only semi-educated, if I'm to say, person in my household. Climate change has been mentioned a few times in our school, but I've never been able to make sense of it, right? Based on what you do and the implication of climate change in health in us, could you explain to me why what you do is important and why climate change should be given attention?
All right, thank you very much, Emeka. I think that's a very critical question. And like the person that you've just described, I think that's a lot of us Nigerians, not only Nigerians, perhaps even Africans, hearing about climate change, but not really grasping or understanding what that is. Climate change speaks to increase in the Earth's temperature due to human activities over the years. So we're talking about over 50, 100 years. And this is largely around the increased emission of greenhouse gases, which are typically heat-trapping gases that help us, necessary for our survival on Earth to keep us warm. But with the increase in human activities and increase in the emission of these gases, it's now becoming warmer than what it is that we would typically need as a race or as a population of people. And with this comes a gamut of impacts or effects with the warming of the Earth. So that's where you start to hear people talk about global warming, climate change impact, and all of that. And I think it's very important that we really are able to distill how this affects us as human beings, because without that, it just becomes another sort of buzzword that everybody's just talking about, but nobody really understands.
Especially on social media.
Exactly. And I'm particularly amongst maybe the less educated people, because let's face it, in Africa, in Nigeria, we have a lot of issues or a lot of challenges that we're still trying to surmount. So that becomes something that is not to be worried about. Whereas when you look at it in actual terms, climate change affects every aspect of our lives. It affects our health, it affects our livelihood, it affects our economy, it affects the way we do what we do, and even our ability to continue to exist as a species, because you can liken the Earth to our house where we live. If our house is on fire, then we really cannot live in that house. We then have to start to look for how to either put out the fire, rebuild, or even just leave the house and look for somewhere else. So as a human race, I know there's been discussions about going to Mars and all of that, but this is where we are now, and this is our home, and we need to make sure that it continues to remain habitable for us as a people.
Back to how it relates to us here, trying to make sense, help people make more sense of the risks, basically the health risks associated with climate change. For instance, flooding happens, there's increased risk of cholera, right? But people don't immediately associate that with climate change, right? Increase in rainfall. So how should they make sense of it, right?
Yeah, so I think that you've given quite some useful examples. So when we look at the climate health now nexus in this context, how does climate change affect or impact on our health? Right. So let's use two to three simple examples. With climate change, increase in temperatures, for instance, we're finding that there's that increase in the survival ability of vector-borne diseases. So things like malaria is a vector-borne disease because you need the mosquito to be able to carry the disease from one person to another. Mosquitoes need warmer climates to be able to effectively thrive. Yeah. So the warmer the climate is, or the warmer the atmosphere is, it means that you have mosquitoes being able to survive better within that space. Nigeria, as it is currently a malaria endemic country. And a lot of African countries or countries in the tropical regions have malaria endemic because the species can thrive. Right. So with climate change and with warmer climates, it then means that we're having more mosquitoes that are carrying more diseases like malaria, dengue, Zika virus, and transmitting it from one person to the other. So you might have malaria. You might not be able to, as a common man, you just know that, oh, malaria. I think typically, even in Nigeria, once you have a bit of a fever or a headache, everybody just assumes it's malaria. But the truth of the matter is that it is directly tied to climate change, in the sense that the more the temperature is getting warmer, the more it's easier for these vector-borne diseases, or for these vectors to survive and transmit the diseases. You look at, for instance, flooding that you spoke about. With flooding from heavy rainfalls, change in rain patterns, heavy rainfalls, you find that we have flooding in a country where we already have, will I say, weak systems, whether healthcare systems, emergency management systems, and things like that, waste management systems. With flooding comes contamination of groundwater, for instance. And once you have that, you start to have outbreaks of things like cholera, typhoid fever. I think there was some months back, there was an outbreak of cholera in Lagos with a significant amount of people losing their lives. So all of these things are things that evidence has shown that are as a result of climate change, and we're getting to see them happen more and more. We're not talking about even larger diseases like coronavirus, Ebola, and things like that. All of this diseases, we're seeing more disease outbreaks happening, diseases that we've never heard of before now, and all of this can be directly tied to climate change.
Right, changing climate.
Yeah.
And based on your work, it seems eHealth Africa has been involved significantly within building resilient health systems, right? Could you tell us more about what you have done, and also your work in leading that climate adaptation for the organization?
Yes.
In that regard.
Okay. So for us at eHealth Africa, our mission really is around building stronger health systems, providing communities with the necessary tools that they need to lead healthier lives, particularly underserved communities or most at-risk populations, not just in Nigeria, but across Africa. And our work around climate adaptation in health is centered, I think I'll say it's cross-cutting, supporting healthcare systems, health facilities, to really adapt and to be able to mitigate the impact of climate change. So be it from vulnerability assessment, impact assessment, setting up renewable energy systems and solutions to help first of all reduce greenhouse gas emissions at the facility level, and also prepare them for, say, for instance, climate events, to make sure that there's continuity of service, not just any type of service, but even quality service in these health facilities in the event of any outbreak. So that's one aspect of our work. There's also the aspect around supporting the design and development of climate smart digital tools for agriculture. So the eHealth Africa Farm Management Tool, for one, is an example of that. It's a climate smart tool that provides insights to smallholder farmers around good agricultural practices in the face of the changing climate, to help maintain and even increase their yield and productivity. So that's speaking to our support around climate adaptation and channeling or mitigating the impact of climate change on food insecurity or food security in Nigeria. So there's actually quite a lot of work that is being done, but I would say these are just snippets of what it is. So basically working with stakeholders, both public, private partners, national government, sub-national government, to really work around how we can make sure that our healthcare systems are resilient to climate change. We've done work around setting up of polio emergency operation centers across about 11 states in Nigeria, and that's also in a bid to help strengthen the coordination platforms for polio and even for public health coordination and response in Nigeria. Right.
In fact, from what you've said, it seems to be a lot that is being done. When you spoke about vulnerability, assessing our own vulnerability and the risk we face, having that assessment, right, and done for various levels, right? How vulnerable are we really, and how much of our data really supports that, right? Because, I know that various public health interventions like this are often driven by, data or from research institutions. How does our research institutions, right, provide the necessary support, or how do we work well with them to, conduct various research and vulnerability assessments, right, of our context, our own local context? Is like the government or the key decision makers aware of the role they should play in this regard?
Yeah, so I'll start from the last one. I think that yes, they are aware. The challenge perhaps is competing priorities.
Right.
Because when you think about it, the health system, the education system, the legal system, there's a lot that the government has to invest in. I think I'll give you an example. In 2015, when we had the then president sworn in, I think it took him about 6 months or so to nominate his cabinet. And in that time, there was a lot of discussions. Why is he going so slow and this and that? And one that struck out to me was conversations around what should be the focus of this government. Nigeria being a signatory to the Paris Agreement, for one, is a testament to the fact that, yes, we do know, or the government is aware that this is a significant issue. This is a significant challenge. I think what is lacking is that, will I say, the financial resource and maybe perhaps even the willpower to really drive the change that we need to drive, to really get to, whether not get ahead, but perhaps get on top of the climate change issue. So in terms of how vulnerable we are and what our research institutions are doing, so there's a lot of work, I believe, that is going on in that sense. But is it enough? I would say perhaps not. There needs to be, will I say, increase in investment around research, data, technology, and innovation for climate and health, or even climate change in general. So we do have maybe organizations, partners, perhaps even working in silos, even government agencies working in silos, collecting different level of administrative data. But what we need to do is to be looking at how can we really harmonize this data. So data collection is one thing. Data analysis, data use for decision making or evidence-based decision making is another component, which I believe is where we're lacking. So we're collecting pockets of data here and there, individual research papers, organizations conducting research. But in terms of being able to harmonize that and really use that to inform evidence-based interventions and strategy for climate adaptation or climate and health, I think that's a critical point that we need to, or the government really needs to look into, I would say, championing and even driving. We do have policies, strategic plans, and all of that around. You find that maybe at best you have it at the national level. Are these policies, are they domesticated at the state level? That's another issue. Even when they are domesticated, are they properly funded to be able to implement this? In Nigeria, we know that budget allocation is different from budget release. So even when you have maybe climate and health in budgets, whether national or state level budget, when push comes to shove, you find that perhaps this is being pushed to the back burner to address more seemingly important things around economic empowerment and all of that, not really understanding or not really putting into perspective that the climate, health, and exhaust has an effect on all of these other things. So it's like you're treating the symptoms and not really the cause of the disease. Absolutely.
So basically, you spoke on connecting the dots, right, with the data, making sense out of the data to drive decision making, but also it has to be done in an agile way, very flexible and very fast. Really, people are collecting pockets of data or operating in silos, right? Although the organization is doing quite well, this is NIMET, the Nigerian Meteorological Agency. They provide weather forecast data on their website. They always predict rainfalls. They always give you data and insights on where we expect high rainfall levels. And at that level, right, that's data routinely made available. But we now talk about how effectively is it utilized. right, to initiate preparedness measures. And we look at, for instance, the flooding in Lagos or various other states, right? But the key thing is, when you have that data, how can we make faster decisions with that data? Or more like, how do we foster or ensure more seamless collaboration so that when these insights are available, they are effectively, utilized, right, to drive action?
So it's very important, like you rightfully said, for that collaboration to happen, because what you see, climate change and its impact or effect are multifaceted. It doesn't just affect one aspect of our life. So for you to be able to prepare properly and even effectively respond to it, you need that collaboration at all levels: government, private sector, non-governmental organization, individuals, community. And I think that the first perhaps step is around creating the necessary level of awareness. So we know about climate change, we hear about climate change. Do we really understand the impact or how it affects us? You talked about flooding in different states, for instance. Typically, Lokoja is one state that also experience, or Kogi State rather, Lokoja town, experiences flooding. You find that once the rain starts, all those people that have houses by the river banks and all of that, of course, the overflow, and then it starts to flood. Where evidence-based decision making comes in is, as a government, what are you doing about that? Exactly. Are you relocating these people? Are you sand filling? What exactly are you doing to be able to say, okay, let's prevent this? So you find in some situations, based on this knowledge, once it comes to rainy season, you find households starting to move towards the higher plains just for that period. But once the rains go back down, they go back to their houses. That's an adaptation strategy. So for back to the question about what can we really do, or what can government really do, I think that collaboration and synergy is very, very key. I talked about budgetary allocation and budgetary release as well. So if we're not able to allocate and release the necessary resources for us to be able to really make a change, that also becomes a problem, because you can have all the meetings, you can have all the strategic thinking, all the initiatives, but you need to be able to back that and drive that with necessary funding to be able to implement these initiatives that needs to be done. There needs to be collaboration, I would even say, across state government, national government, even regional government. We need to have a robust framework that enables us to not just implement initiatives or innovative ideas, but allows us to share resources, allows us to leverage on each other's strengths in the fight or in the mitigation of climate change.
Yeah, absolutely. Because like you said earlier, these things sometimes they're bound to happen, but at best we mitigate their impact so that when they do happen, they don't disrupt our lives entirely. They don't disrupt healthcare services entirely. We should be able to continue these services, right? Especially for those of us in the health sector, trying to ensure these mitigation and adaptation strategies and measures are put in place. And of course, more awareness about what can be done in terms of when we have insights from organizations that collect such data and insights, make them available to drive decision making, foster collaborations within these organizations. If you have organizations that are interested, right, in playing more active role or making meaningful impact or investment to mitigating the impact of climate change on health, where should more focus? Where should be given? Where do we channel more attention or more investment or more resources towards addressing?
Yeah. So we talked about awareness. I keep saying awareness, because at the end of the day, no matter where you channel your funds, climate change is as a result of our individual and collective actions, right? So our day-to-day, everyday actions. So you can pump in money, but if I don't change, you don't change, it means that we're just pumping money in and treating the symptoms and not, how do I put it now? We're not treating like the root cause, of the climate change. So that's one. We've talked about research as well. I think there needs to be a lot of investment in research, not just research around disease surveillance and predictive modeling, but even research around the impact of some of these interventions. So impact assessment, what has been done over the years? How is this moving the needle at all? If it is, what is moving the needle? What is not moving the needle? That's where we come to evidence-based decision making. There needs to be further investment as well in technology and use of digital tools to be able to drive some of this. So whether it's collection of data, whether it's analysis of the data, also again tying back to evidence-based decision making. We need to make conscious efforts as well to invest in building resilient health systems. So health infrastructure, health facilities, what is needed for them to be able to effectively address the public health in cases of outbreaks or climate events. We need to invest in capacity building. Not somebody said something recently to me, capacity building is not training. While training is part of it, but being able to build the capacity of the health workforce, not just by just generic training, but to really be able to understand, because this health workforce, they are also people like me and you, they are common. So if I don't even understand what climate change is, I don't really understand the impact, whatever training you're giving me, yes, it's a training, I'm just participating in training for it, but I need to be able to really understand it, and I need to really be equipped to be able to respond to it as needed. So in terms of disease preparedness, outbreak response, we need to be able to invest critically in capacity building of the health workforce to be able to do that. Because like you said, we perhaps can't run away from it. What we can do is try to maybe slow down the process, and also for the ones that are already in motion, look at how we can adapt and mitigate it. So technology, research, capacity building, I think all of this, if we're able to do awareness creation, if we're able to do that, we should be able to move the needle in mitigating climate change and its effect.
Yes, thank you. And I like how you emphasized on impact assessment, right, to ensure that we're not duplicating efforts and resources, because that tends to happen a lot with some public health interventions, and would have really loved to take as much as possible from, to have more of your takes during the course of the conversation. But of course, it's an ongoing conversation. The climate change series, the climate conversation series we're having now, and it leads up to the Future of Health conference. What do you look forward to in the Future of Health conference? And is there any aspect that you feel isn't given sufficient attention that should be given more attention? Any, say, adaptation strategy or measure that you feel is a good case study that should be scaled or adopted more?
Yeah, so for what I'm looking forward to, and even eHealth Africa, is to continue to lead and be part of the discussions around climate change and its impact. And we're happy to be partnering with Nigerian Health Watch for the Future of Health, the 10th edition of the Future of Health conference. And we hope that platform not only gives, room for discussions around this, but also gives room for actionable insights for us and other partners as to how we can really take the conversation forward and really start to, implement more targeted, tailored interventions that could help us mitigate the impact of climate change on health and public health in general.
Yeah, right. So now back to you specifically, and this is like our closing segment on the podcast. So I would ask you 3 questions, and I would want you to answer in 60 seconds if possible, right? Imagine you could implement one universal rule that everybody in the world had to follow to address the climate crisis. And I'm talking about everybody, including individuals. What would that one universal law be?
Perhaps it will be around reduction of greenhouse gas emissions. Again, back to cause effect treating the root cause as against treating the symptoms. So if we're able to effectively do that, I know that a lot of Western countries are more, will I say, aware and are ahead of the curve in terms of actively trying to reduce their greenhouse gas emissions. So if there was a law that I could pass, it would be around that, mandating countries to not just develop policies, but actually be intentional about implementing policies that help to reduce the greenhouse gas emissions, because only then can we perhaps reduce the occurrence or the impact of climate change in our day-to-day lives.
Just to finish my the questions of the closing segment, I would ask the two questions. I'll ask two questions, the last two questions together, and which is, you've been involved in this space for quite a while, in climate conversations, and I've really you've been quite engaging on the show. Who would you recommend for this to have as a guest on the show, and what question would you want to ask them? Would you want them to answer?
Is it one person? So if we're looking at it in
you can give us two.
Well, maybe multiple. Let's look at the Nigerian context. So I don't want to say the Minister of Environment for one, because I know that but it will be maybe someone in government.
Okay.
To really understand, we've talked about some of the issues or some of the barriers, but the question will really be, what would it really take for us to really be, would I say, more intentional and serious about climate change and health? So maybe even the president, because at the end of the day, whatever it is, he's the leader of the country. So it will be, as a Nigerian, it will be, that question will be to him. So we've signed on to the different international agreements and treaties around climate change. But what do we really need to do? What is really the barrier to us being able to, and what do we need to do to get us moving in the right direction?
I really have loved to continue these conversations. There's more than enough to talk about, but of course, we are thankful that we have a conference to take all of these and more. Of course, it's going to be a hybrid conference, and really look forward to having conversations with eHealth Africa as a sponsor and a partner. Thank you so much, Temi, for joining us on the show. It's really been a delightful conversation with you, and we hope to continue this conversation beyond this show.
Yeah, thank you very much for having me as well.
Great.